The United States has the most expensive healthcare system in the world. In 2023, national health spending grew to roughly $4.9 trillion. Yet for all of that money spent, we have some of the worst health outcomes compared to any other high-income countries. Our life expectancy is years lower than the average, and we have some of the highest rates of preventable death. So what's going on here? As a functional medicine practitioner trained in Chinese medicine and systems biology, I can tell you our system is absolutely brilliant at one thing: crisis care. If you get in a car accident, have a heart attack, or need emergency surgery, there is no better place to be than the conventional paradigm. It's a masterpiece of engineering designed to pull you back from the brink. But what about the slow burn of chronic disease? Diabetes, autoimmune conditions, heart disease, and digestive issues that are so common today. This is where the conventional paradigm often falls short. According to the CDC, 6 in 10 US adults have at least one chronic condition, while 4 in 10 have 2 or more. Our system is great at asking what. What's your symptoms, and what drug can we match with it? But it often forgets to ask the most important question in chronic complex illness. Why do you have this problem in the first place? In this video, I want to introduce you to a different way of thinking about healthcare, an approach that starts with asking why. It's called functional medicine, and it represents a real shift in how we look at illness. We'll break down the 7 key differences between the functional medicine approach and the conventional care paradigm most of us are used to. We're going to start with conventional medicine and its ideological approach. This system, we all know, is based in reductionism that breaks down the body into the smallest parts possible, and each body part gets its own specialist. If you have a heart problem, you see your cardiologist. A skin issue, your dermatologist. Gut troubles, a gastroenterologist. The focus becomes on the specific organ and the named diseases associated with it. Functional medicine, on the other hand, sees the body as a single interconnected ecosystem. It operates from a systems-based perspective, understanding that a problem in one area can easily cause or be caused by a problem somewhere else. It doesn't just treat the organ, it treats the whole person. A functional medicine practitioner, for instance, understands that your eczema, your migraines, and your IBS might not be 3 separate issues like it is in the conventional paradigm. They could be 3 different expressions of a single underlying functional imbalance. It's about seeing the entire web, not just looking for one broken string. The second difference is around the paradigm's differences in prevention. Both conventional medicine and functional medicine believe in prevention, but they don't exactly mean the same thing by it. In the conventional world, prevention usually means early detection. This includes routine screenings like mammograms, colonoscopies, pap smears, and routine lab work. This work is incredibly important and saves lives, but it is fundamentally about catching a disease that has already started. Functional medicine wants to take that a step further back. It defines prevention as optimizing your health to stop disease from ever getting a foothold. The focus is on finding and fixing suboptimal function long before it ever shows up on a standard test as pathology. It asks, are your body's systems working at their best? Are you getting everything you need to thrive, or too much of something? The goal isn't just to be not sick, but to actively create a state of resilient health. Think of it like this. One approach is making sure your fire alarm works, while the other is building your house with fire-resistant materials from the ground up. The third difference is with lab testing. In the conventional model, lab tests are used to spot outliers that fall outside of that normal range. These tests are vital for making a diagnosis, but they're often limited to what insurance covers and are designed to confirm specific illnesses, and it's usually guided by what a doctor is already suspecting. Functional medicine, however, uses broader, more detailed ranges and specialty lab tests. These tests aren't just looking for a full-blown disease, they're looking for subtle functional imbalances. For instance, a standard cholesterol test will tell you your total LDL, the bad cholesterol, and the good cholesterol. But a functional test might go way deeper, looking at things like ApoB status or the size and density of those LDL particles, since smaller, denser particles are more strongly associated with cardiovascular risk. Other functional tests might map out your gut microbiome and digestive function. They measure nutrient levels, check for hidden food reactions, and assess your body's toxic burden. It's a totally different language because we're outside of the realm of diagnosis. This advanced testing gives a higher definition picture of your unique biochemistry. It helps to uncover the quiet dysfunctions on a spectrum of function to dysfunction that can be going on for years or even decades before it becomes disease. The fourth difference is in treatment philosophies. This might be one of the most important and dramatic shifts between the two paradigms of all. The approach to treatment. Conventional medicine focuses on managing symptoms. If you have high blood pressure, you get a pill to lower it. Acid reflux, you get a pill to block acid. Joint pain, an anti-inflammatory drug. There's a classic analogy for this. Imagine that you have a tack in your shoe and it's causing a lot of pain. The conventional approach would be like taking a painkiller for that tack. The pill might work for a bit, but it doesn't really fix the problem. The moment it wears off, the pain is back because the tack is still in your shoe. Functional medicine, instead, is all about finding and addressing the root causes. It asks, why does this person's foot hurt? It looks inside the shoe, finds the tack, and pulls it out. The goal isn't to silence the symptom, but to restore the body's natural function. It asks, why do you have high blood pressure? Is it a nutrient deficiency? Is it blood sugar balance issues, chronic stress? By fixing and addressing the root causes, the goal is to resolve the problem for good, not just manage it forever. The fifth difference lies in the timing. Conventional medicine is largely reactive. It tends to intervene after a person has already developed symptoms or a diagnosable disease. The primary interventions are pharmaceuticals and surgical procedures to manage a problem that's already there. Functional medicine is designed to be proactive. By identifying dysfunctions early on, it aims to intervene before the house is on fire. This proactive stance empowers you, the patient, to make changes that can steer your health in a different direction, away from a future of chronic illness. It's a shift from a wait-and-see model to a plan and prevent model, and it makes you an active partner in your own health journey. The sixth difference is the emphasis on lifestyle. This brings us to a really huge difference, the role of lifestyle as a primary intervention. In a typical medical visit, lifestyle advice can feel like an afterthought, where the doctor might say to start eating better or lose weight. But with limited time, and the main tools are still prescriptions and procedures. In functional medicine, lifestyle change isn't an afterthought, it's the main event. It's the most powerful tool in the toolbox for setting the foundation for long-lasting health. Practitioners work from the understanding that our genes are not our destiny. They're actually a blueprint that is profoundly influenced by our daily choices and lifestyle factors. Lifestyle literally turns on and off our genes. Functional medicine recognizes food as medicine, creating specific therapeutic nutritional plans to lower inflammation, body burden of stress, and support healing. It also incorporates personalized strategies for movement, stress regulation, and sleep improvement. It recognizes that these factors aren't alternative health, they are foundational health, and these inputs decide how our bodies work day in and day out. The seventh and final difference between these two models is that they simply excel at different things. Conventional medicine is the undisputed champion when it comes to acute care. For trauma, life-threatening infections, and surgical emergencies, it's second to none. Functional medicine strength, however, lies in tackling complex chronic illness. Conditions like autoimmune disease, type 2 diabetes, and digestive disorders often grow from a web of interconnected factors that develop over years. These are the exact kinds of problems where a root cause approach shines. In fact, studies from institutions like the Cleveland Clinic have shown that a functional medicine model is associated with meaningful improvements in health-related quality of life for patients with chronic issues. It's not about rejecting conventional medicine, but it's about having the right tool for the right job. So what's the takeaway here? We have two very different approaches to medicine. One is a reductionist reactive system that focuses on managing acute problems, primarily with drugs and surgery. The other is a holistic proactive system focused on finding and fixing the root causes of chronic disease, using personalized lifestyle changes and advanced labs. Neither one is good or bad. They are different tools for different tasks. The future of healthcare isn't about choosing one over the other. I see it as blending them wisely. We can leverage the power of conventional medicine for crises while embracing the functional model to prevent and reverse the chronic diseases that are so prevalent in our society. This represents a shift from a system centered on managing disease to one focused on creating health. It's about moving past the question of what drug for what disease and starting to ask why the problem is there in the first place. It's an approach that is predictive, personalized, and participatory. And most importantly, it empowers you, the patient, to get out of the passenger seat and to take the wheel of your own health journey. If this way of thinking resonates with you, please subscribe to the channel and learn more about taking a root cause approach to your own well-being. And when you're ready, watch part 2 of this series or check out this video where I share the 5 truths that I learned about holistic healing. I'm Dr. Kenny Middlestat, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.